I'm going to be your student nurse today. Can I get your name and date of birth?
Leanne Harshberger, 06-2102.
Okay, so I would perform hand hygiene. Okay, so we're going to be doing an abdominal assessment today, is that correct?
Mm-hmm.
Okay, so first I'm going to have you lift your shirt up. So I'm going to note that her abdomen is flat with even coloration, pale throughout. Her umbilicus is in the midline. I note a few macules, and I don't note any pulsations in her abdomen. Next, I'm going to auscultate in all 4 quadrants. So I'm going to start in your right lower quadrant to test for the ileocecal valve. So I'm just going to have you breathe in and out. Okay, so I heard 5 to 30 bowel movements, and I didn't hear presence of a bruit, and I heard normal pulsations. Next, I'm going to test or listen for vascular sounds using a diaphragm. So I'm going to go 2 inches below her xiphoid process and then 2 to the left. Okay, so I didn't hear a bruit, which is expected. Next, I'm going to percuss in all 4 quadrants, so I'm going to place my hand like this, and I'm going to tap. Any pain or tenderness?
No.
Okay. So I didn't hear dullness, and I heard tympanic sounds, which is expected. So next I'm going to percuss for CVA tenderness, which would test for a kidney infection. So I'm going to have you sit up. So I'm going to go posterior below your 12th rib, and I'm going to hit like this. And I'm going to have you tell me if there's any pain or tenderness. Any pain or tenderness?
Mm-mm.
Any pain or tenderness?
Mm-mm.
Okay. I'm going to have you lay back down. So she didn't have pain or tenderness below her 12th rib, which is expected. So next I'm going to palpate in all 4 quadrants. Okay. So let me know if you have any pain or tenderness. So I'm going to start out with light palpation, which is 1 to 2 centimeters. So I didn't feel any masses in your stomach, which is expected. Then I would do deep palpation, but that's deferred. So next I'm going to check for rebound tenderness. So if my patient had pain in her right lower quadrant, I would take my hand at a 90-degree angle and push in. Any pain or tenderness? No. If she did have appendicitis, there might be referred pain or tenderness on her left side. So next I would palpate the liver. I could do a hooking technique or the bimanual technique. The hooking technique is where I would stand at her shoulder, and when she exhales, I would push down and hook to feel for her liver. And then the bimanual technique is where I would place my left hand under her rib and my right hand on top, and I'm going to have you inhale and then exhale. And I didn't feel for her liver, which is expected. Next, I'm going to palpate your aorta. So I'm going to find her xiphoid process and go 2 centimeters down and to the left. And I'm able to palpate her aorta. Okay. So this concludes our physical assessment. Everything that we tested for was in the expected limits, and the tests are kept confidential. I thank you for coming in today. Do you have any questions for me?
Nope.
Okay, thank you.